Hi, my name is Lupe Romero. I am 50 years old. I am living with pancreatic cancer, diagnosed February 11th of this year. Today was chemo day for me. I originally, in, uh, in March, I was started on a less aggressive chemo. It's called Gemside. And I had 7 sessions of this Gemside, but after 7 sessions I had a CT scan, and the CT scan showed no shrinkage of the cancer. It's a good thing. It didn't spread, but it also didn't shrink. My cancer is attached to the mesenteric vein, which goes to my heart. I did have an attempted Whipple procedure, but that's when they found that the vein attached itself to the cancer attached itself to the vein. I notice in my videos sometimes I say things that are kind of sometimes don't make sense. I always call that my chemo brain. So anyway, then the doctors closed me back up, and that's when I started the chemo. And so after the first 7 sessions of the Gemside, then I had a CT scan, and it showed no improvement. So then I was started on FOLFIRINOX. FOLFIRINOX stands for 3 different types of chemo that are used for colon cancer, and those are used individually depending on the type of colon cancer a patient has. But when these 3 chemos are combined, then they found that they have a good result in shrinking pancreatic cancer. So I'm on that. Today was my 5th session. I have 1 more session before another CT, and then that'll determine the next step. The next step is possibility of another surgery, but this time I'm going to another facility, UCLA, and to the pancreatic clinic, and they do the Whipple, but the most important thing is that they can do a bypass. They can remove that vessel along with the cancer. So anyway, this morning my husband and I got up at 7 in the morning, and we walked 3 miles. We try to walk 3 miles as much as possible, and we also try to hike. I try to hike once a week to keep myself healthy and active. It's very important to exercise when you're not feeling well. My husband is also sick, and he pushes himself to walk with me, and we take care of each other. My appointment was at 9. When I got there, the first thing the nurse does is she freezes an area in my chest where I have a portacath. This portacath is the size of maybe a nickel. You can see underneath the bandage, you can see this little bump that sticks underneath my skin. So when I first get there, the nurse freezes this whole area to try to numb the area, and then she pokes a needle into this portacath. It's still uncomfortable when she freezes it. You know, it's uncomfortable because like somebody putting feels like frostbite, I guess. And then she puts the needle in there, and then the first thing that she administers is an anti-nausea medication. I have a total of 6 bags, and so she administers the anti-nausea medicine. And then after that, it's a bag of calcium and enzymes. The calcium and enzymes break up the blood cells to help me tolerate the chemo. And then it's a bag after the calcium and enzymes, and it's 2 bags of the colon cancer chemo. And then after those are done dripping, then I get another bag of the calcium and enzymes again to help break up the blood cells to help me tolerate the chemo better. Those first 4 bags, or actually 5 bags, take a total of 3 hours to drip. But then the last one is the heavy duty chemo. This is a large bag, and this is dripped very slowly over a period of 2.5 to 3 hours. It has to drip very slowly, because if it drips fast, I can get really sick. right at that moment. And this last bag is what gives me symptoms. And so today, sometimes when I have my chemo, it's 6 to 7 hours. Today it was only 6 hours, although it felt longer. My sister has come to every single treatment, except, well, I can't say every, she's come to every treatment with my first Gemside and then this Filtheranox, except for 2 times. And this time she was going to come with me, but her car broke down, and she felt bad about it, but she shouldn't, because since my husband and I walked, I napped, and my husband usually stays there too, but he came home and I was able to nap practically through my whole treatment, so that was a good thing, except for like the last hour. Then the last hour, then then I get fatigued and I'm ready to get out of there. But then we came home, and I did feel a little fatigued. This sort of cancer treatment causes very severe side effects on most patients. It'll cause you to have vomiting and diarrhea and loss of appetite, and it'll cause you to get blisters on the inside of your mouth, and it'll cause you to lose your hair. I'm very blessed that I haven't had any of that. Today, after the chemo, I feel fatigued. So since I got home, I have been working on my garden outside. I've been clipping the dead leaves and just kind of working. There's my husband over there maintaining my yard. He's so awesome. I don't know if you can see him, but he's amazing. He maintains my yard for me. And so then I've been in and out. I worked on my yard, then I went inside, and I was going to clean my room, but I thought, nah, not today. And then I went on Facebook for a little bit, and then I answered some texts. I was having problems with my phone earlier, so then I resent a bunch of texts to let my family know how I was doing today. And then now I'm doing my video for today, and my husband made me this nice shake, because but the only thing that I really have a problem with right now after my chemo, and this will last several days, is that my skin becomes very, very sensitive to cold. I had viewed the Patrick Swayze video, and he expressed that when he touched cold or went near a refrigerator or anything cold, it felt like he was being jolted by bolts of electricity, so it'd be really bad. Mine is not as bad, but when I do touch cold, like I can't wash my hands with cold water. The water must be warm, or hot feels really good, because it literally feels like my fingers and my hands freeze. Sort of like those sci-fi movies. It's like the minute I start touching anything cold, I can feel my hands just like they're frozen, like ice, like if I were to bend my fingers and they would break off. And so my whole body is sensitive to cold. And then I've also been getting a little sweaty. When I get sweaty, I feel fatigued, but that doesn't last too long. And so my husband made me this really nice shake. It's a strawberry shake with blueberries, and